Okay.
Yeah.
So we're recording. So welcome, Polly. Just welcoming Polly here, chiropractic by hand, based in Balham, South East London, and we're going to talk about all things kind of birth and preparing the body for labour and birth, like both in pregnancy and beyond. And yeah, just kind of over to you, really, Polly. I thought we could start off talking about preparing for labour and maybe when you think it might be the best idea for a woman to come and see you. Would it only be if, for example, we're going to talk about breech position and back-to-back babies and all that kind of thing, but let's say a woman's on her pregnancy journey, what would be, what would you recommend she did or how she saw you?
So yeah, I wish every woman was able to access chiropractic, and in terms of when's the best time to start, there's no right or wrong. In a really ideal world, I would recommend actually people starting care pre-conception. And actually getting the body ready. We've actually, some people feel that it's helped them conceive. There's absolutely no evidence for that, but that's just case study, just anecdotally, let's say, but if you know that you're starting your pregnancy with a nice balanced pelvis, then you've done a lot of the work already. Nowadays, and particularly nowadays, this past year, the majority of women are sitting all the time. So even, we have a heavy pregnancy base at our clinic, but actually we're really busy with everyone at the moment because everyone's sitting, seeing lots of hip pain, lots of hip problems in all populations. Because everyone's working from home, not necessarily sitting at the correct desk setups, holding the correct posture, and we're just not moving as much as we should. It's interesting. A lot of my patients sort of at the beginning of the first lockdown, or whatever, going, no, I've always done a desk job, and I'm still just doing a desk job. I'm like, yeah, but previously you were walking to the train station in the morning, then from the train station to the office, then around the office, and if you had to go and ask someone a question, you'd get up and go to Mike's desk or Jane's desk, or and then those journeys on the way home. So you've got lots of multiple
lunch breaks and stuff, and
and now especially in London, some people have got to walk from their bed 3 steps to their desk. We don't also live in necessarily mansions in London, so it's not like you're even going downstairs, for example. So so we're seeing a lot of issues anyway. So in an ideal world, my ideal patient would be coming in pre-conception. If not, then again, there's no right or wrong, really. Some people might not want to come in their first trimester because you just feel a bit miserable anyway. But definitely as you start to feel things growing and changing. And then a lot of our patients present because they have got pain.
I was going to say that I guess that's the main reason that bring them to see a chiropractor, because they're feeling pain. But even if they weren't feeling pain, would it be a good thing to just get things checked out?
Absolutely. Alignment, alignment and function is key, basically. The pelvis goes through a lot during pregnancy, and and what we do as chiropractors is support the pelvis, basically, and we give out exercises and stretches and what have you to also support mum in how she can support her changing pelvis.
Okay, brilliant. So early on, maybe second trimester, or if she's feeling any discomfort, things like that. I suppose it would vary as to how many treatments she may need or sessions. I mean,
absolutely. I mean, generally at the start of someone's care plan, we'll see them quite frequently to make the changes as quickly as possible. It's very much like going to the gym. You're going to get results a lot quicker if you can go more frequently. So, we might see someone twice a week for 2 or 3 weeks, for example, potentially. Again, it depends. If they've got symptoms, it depends what our our care plan goals are as well.
Yeah.
So if someone's got symptoms, then obviously we want to get them feeling better as quickly as possible. So that's when we might do sort of quite frequent appointments initially, and then we sort of decrease the frequency. And then what we often see in pregnancy compared to, say, the patient that isn't pregnant, is that then the frequency, we might increase the frequency from, you know, week 35 or something, because actually by this point things are getting really uncomfortable and unstable because of the effects of the hormone relaxing, which is making everything loose. And so sometimes, you know, even though they might have then only been coming in once every 2 or 3 weeks, we then might ramp things up again to weekly or whatever works for them.
And I do hear, like, well, I remember it well myself, that had that horrible hip pain, you know, because you're encouraged just to sleep on your side, or at least start on your left side. And oh god, I'm thinking there must be something that no amount of anything would help that hip pain. Is that something that you could help with, or is that just something women?
We see, a lot of women report that they feel a lot better after our care. Now, I always explain that we can't change that, you know, at the end of the pregnancy you're carrying around a potentially 6, 7, 8 pound, 9 pound weight in your pelvis. Like that's always going to be, that's always going to bring a level of discomfort. We can't change that. We also can't change the effects of the hormone relaxing, so everything will be unstable. We can't switch relaxing off. We can't, you know, give you less relaxing. So things, discomfort in pregnancy we could deem as normal, but pain, no. I sadly hear a lot of reports of kind of GPs, midwives saying, oh, it's just because you're pregnant. And that I don't agree with. Like, no, you shouldn't have to put up with pain. So I do explain to patients, look, you probably will be a little bit uncomfortable in bed, but let's, you know, loosen the, you know, it's usually that the glutes are really tight because they're trying to support everything. So with our hands-on, you know, our manual therapy, our treatment we do, stretches, and then lifestyle advice. So I do demand basically that all my patients use a pregnancy pillow. If not a pregnancy pillow, you know, they have to have sort of pillows between their knees and between their ankles, and that's something that not all pregnancy pillows provide, but the keeping the ankles separated is really important. And I often demonstrate it to my patients, and you can even see the difference almost actually when you see that if your ankle, even if your knees are apart, having your ankles together puts more pressure on the hips.
I can see that. And that's funny because I'd always put mine between the legs. I never thought of doing it between the ankles. That's really that's really makes sense now you say it.
It makes such a difference. I'm 20 weeks pregnant at the moment and starting to feel that just discomfort in bed. You know, I'm just sort of waking up in the night to go to the toilet and just thinking, oh you know, I'm just not as comfortable as I used to be. But I've got a pregnancy pillow that goes all the way down to my ankles, and it's dreamy. It's dreamy. But of course you do sometimes sort of come off it, or you have to turn over, and you don't always take the pillow with you and stuff. But if you can spend a good proportion of your night with your knees and ankles separated, then that really helps.
Takes the pressure off the hips and stuff.
Okay,
brilliant. And the pelvic girdle pain is something, again, as I hear a lot of the separation. Maybe explain what it is for those who don't know.
So pelvic girdle pain is actually really it's an umbrella term. You know, the pelvis is a big structure made up of several bones. So pelvic girdle pain, actually, a lot of people think that that's just talking about that kind of groin pain, but pelvic girdle pain can be just any pain around your pelvis. So it could be at the front, sides, back. So it could be due to your sacroiliac joints at the back, which are your big pelvic joints at the back. So if you put your hand sort of on your back, you know, the kind of knobbly bits you feel at the back. So you've got two little sort of knobbly bits. So a lot of people get sacroiliac dysfunction, which causes pain. Then you've got that horrendous
at the front,
often crippling, literally, you know, people come in on crutches to see us sometimes. They can't wait there because of that. that groin pain around the pubic bone, and that is usually due to because the pelvis is, you know, in two halves, let's say. Well, how I like to do it is struggling to do it on here.
You have your hands around you, I you like that.
Like that. Yeah. Basically, yeah, my thumbs are the front, the front, yeah, okay. The two sort of pubic bones, so the symphysis pubis, they come together, they should sort of line up nicely, and between the symphysis pubis you've got a bit of cartilage. What usually causes what we refer to as SPD, so symphysis pubis dysfunction, is when the pelvis has become kind of twisted, which is what we see in most of our patients because of sitting a lot. As women, we tend to cross our legs a lot.
I'm doing it now, stop.
cross our legs a lot, and that causes that. Even sort of spending 10 years going into the office with one handbag, with like one shoulder bag, that can cause this sort of twist and rotation in the pelvis. And actually, I see the worst sort of pelvic dysfunction and misalignment in second or third time mums, because they're holding little one, they're holding a toddler potentially,
hip pushed out,
one hip, and we tend to, you know, just have a side that we favour, so then that creates that imbalance. So what happens is, where those two pubic bones should meet, they get kind of separated, and that combined with the relaxing plus a heavy weight, you know, plus carrying a bowling ball in your pelvis, just leads to, and because the relaxing and the instability, it just all kind of not collapses. That sounds awful, but it just can't hold and support the weight. Yeah, and so then you get this severe inflammation of the area. But we see great results with relieving that.
Yeah, I had that with my second actually. It was crippling at the front. I remember, shudder now.
That lightning pain, that inability to weight bear.
Turning over in bed was just such an ordeal.
Yeah.
And I saw a chiropractor actually and sorted it.
Brilliant. Yeah.
Many years ago. Yeah. But, So I was so glad. Even after just one session, I walked out feeling.
Yeah, I mean, it can be kind of quite instant. Yeah, people sometimes come in on crutches and then walk up the stairs to leave. It's quite sometimes a bit wow. You know, it still takes people by surprise how quickly they can get, you know, good results. So.
Yeah, and especially as it can happen early on. You know, like even at 30 weeks or beyond this, it's still got potentially 10 plus or whatever weeks to go. Pain.
Yeah.
It's horrible.
And with someone, so I was a bit anxious going into pregnancy myself, in that I have what we call hypermobility.
Oh yeah.
So some people are just more hypermobile than others. So they're just more bendy. Their joints move more. There's a real, you know, there's a spectrum, and actually if it's really bad, then you might have something called like Ehlers-Danlos syndrome, or an actual sort of syndrome which is really severe. But for a lot of people, they may be sitting down here on the scale. So like myself, I have elements of hypermobility, but it's totally, you know, I know how to manage it. So people that are already hypermobile going into pregnancy, they can start to really suffer with all of this a lot earlier on, because they've already got almost those effects of the relaxing that kicks in later. They've got that. So then also when the relaxing kicks in as well, it can be, you can feel like jelly. Yeah.
That must be hard. Yeah. The other thing I wanted to talk about was breech babies and the Webster technique and back-to-back babies. And I know we were saying before we started recording that I know anecdotally, even before lockdown, midwives are saying they seem to be noticing there are more back-to-back babies than usual, maybe because we lead more sedentary lifestyles. And we did a couple of generations ago. We sit on our lovely squishy sofas or lean back. And I wondered what you had to say on, well, first of all, back-to-back, which I hear an awful lot of. Any thoughts on that? And then secondly,
so as the work we do with chiropractic, in clinic I see a lot of babies that aren't in the, let's say, OFP's optimal fetal position, back to back being one, obviously, breech can be various different ways of lying, but it's basically baby isn't head down. Yeah, definitely seeing more since lockdown. And yeah, back to back is often because of this sitting, this kind of, I really encourage my patients to make sure that their hips are higher than their knees when they're sitting. So yeah, leaning back on a sofa, the opposite happens. You end up with your knees higher than your hips. And baby just doesn't have the space to sort of get into that. Ideally you want the baby's spine along your tummy, not your baby's spine against your spine. So yeah, there's not sort of specific things that I will do for, this baby's back to back, so I'll do this. Because basically, however the baby's lying, all I'm there to do, as chiropractors, all we're doing is creating space in the pelvis, because that's essentially what the baby needs. And when the baby's not in the correct position, it is often because of a lack of space in the pelvis and because of dysfunction of the pelvis. It is important to note, and the first thing I always say to my patients that come in with breech presentations, for example, is whilst we get a really good success rate of babies turning after carrying out the Webster technique, that we must always appreciate that sometimes there is a reason the baby is breech, and sometimes we just have to respect that. So it could be that actually the cords are wrapped around the baby and we're not aware of that hasn't been picked up, and so the baby's actually doing what it needs to do to protect itself. I've had cases where there was a misdiagnosed huge fibroid which was getting in the way. Cases of sort of a short cord, placenta being kind of retained because of previous scar tissue from previous births, things like that. So all we're doing, so it's important to say, I never am turning the baby. I'm just working on the dysfunction that I find in the pelvis and the surrounding tissues, so even up into the diaphragm, under the ribs, the round ligaments at the front there, and just making sure that the baby's got optimum space in the uterus, and it will then, if it's able to, sort of.
It's going to have to happen after that work. So there's no turning, not like an ECV where they literally try and turn the baby.
We don't. I will palpate the baby, because I palpate the abdomen to get an idea of what the baby's doing.
And you had some amazing stats, didn't you? So ECV is roughly about 50% success rate. That's when they manipulate and try and turn the baby. And yours, remind me again what your stats were?
So I did an audit, but it was about 4 or 5 years ago probably now. And our success rate at that point was 76% success rate. And I know that because I think all those women postnatally, or at least heard from them, they all went on to have sort of normal vaginal deliveries, and 24% that didn't turn. Again, I know the outcomes of those, and it was the things that I mentioned, the things that nobody could have influenced externally, and actually C-section was the best option for those babies. I will. This has prompted me to do another audit, because I think we might even be we might be up to sort of 80% or more now, actually, which which is brilliant.
Incredible, isn't it? So the Webster technique is like a type of chiropractic work, is it? Is it just a certain way of creating a different? How's it different to normal chiropractic? Is it just like a?
So it's a protocol. Let's say it's a certain way of doing things. We go on a course, postgraduately. Don't think that's the word. It's a postgrad course that you do to get your certification. So when I did the certification, I can't say that I learned any new techniques. but it was just learning the process of doing it.
The order,
the order, the order, and learning, there's a lot of, obviously learning the theory behind it, and the science and the anatomy, and I mean, I knew all the anatomy, but just understanding the importance of the order and what have you. So I'll be honest, I was getting good results before doing the Webster technique, just through doing pregnancy-based chiropractic work.
Yeah.
And I was essentially kind of doing the Webster technique, but just not, again, sort of all in that order. So yeah, once I went and got the certification, which was about 10 years ago, no, yeah, God, a long time ago, no, maybe about 8 years ago, I think.
Yeah.
Got the certification, and actually did see my results sort of improve. So I do really urge people, specifically if they, anyone pregnant can see any chiropractor that specialises in pregnancy, and I do always say, do make sure you see someone that has done some training in pregnancy care. But specifically for breech presentations, I really do. The thing is, Webster certified chiropractors are few and far between, but if it's worth even kind of travelling for, to be honest, to make sure you see
their stuff. Yeah. And what about postnatally? Do you think, is it again with chiropractic work, anything women should be thinking about afterwards, or
obviously,
or only if they've got pain, or anyway, or
again, it's sort of, I do encourage my patients to come in postnatally for postnatal check. Again, they often say, well, when should I come in? And I just say, when you're ready to be touched, when you're ready to leave the house, when you're ready to be touched, when you're ready to put the baby down for 15 minutes during the appointment, whatever it might be. Again, there's no right or wrong, but I do say, please don't forget about yourself, because what we commonly see is, we see them up until baby's born, and then mum forgets about herself. She'll bring baby in, because we see newborns as well. She'll bring baby in, but forget about herself. So I always say, please, you can't look after your baby if you're in discomfort, or, and obviously, again, the pelvis goes through a lot, even with the most straightforward, normal vaginal birth with no intervention. It's still a huge, almost trauma to the body. I don't want to use the word trauma, actually, but it's a lot to go through. It's like running several marathons, So to have a bit of care afterwards to ensure, again, that, and then postnatally, let's be honest, you're going to do a lot of lying around. You're probably going to sit in some, silly position, you're going to be slumping a bit, whatever, not thinking about your posture, because again, you're now not thinking about yourself, you're thinking about your baby. So it is a good idea to just make sure that, again, pelvis is in the best position for the healing process, and for those that then want to start some exercise, around the potentially sort of 6-8 week mark, they can feel a bit more confident that things are kind of ready to go as such. I would say, if people don't make it in before 6 week, before their 6 week check, definitely kind of around the time of that 6 week check would be a good time to come in. But what we see a lot of is mums coming in, particularly that are breastfeeding, with upper back and sort of mid back pain, because
kind of hunching
over again, just in the middle of the night, whack the baby on, not necessarily setting themselves up with their cushions and their support. Again, I sort of always really recommend to have a good breastfeeding pillow, because that really helps. So we sort of see a lot of women coming in antenatally for lower back and pelvic pain, and then a couple of months postnatally, 6-8 weeks postnatally, and coming going, oh my God, my upper back, my shoulders, my neck, sort me out.
Or sometimes just like a funny turn, you're like, oh my God, what did I do? It's like the tiniest turn in a weird way, and now suddenly I'm hobbling along. It's like,
and looking after a baby with a bad back is not.
And it's still got the relaxing for six odd months, isn't it? Kind of rattling around.
And particularly breastfeeding. Breastfeeding women, breastfeeding kind of prolongs those sort of pregnancy hormones. So whilst a woman's, they decrease, but whilst a woman's breastfeeding for a year, 18 months, whatever it might be, there will always be that element of slight instability and things not just being quite back to how they were sort of prenatally.
Yeah, brilliant. Okay. Trying to think any other. I think that's all the questions I had, and it's more. Is there any self-help stuff women can do? I think you talked about the pillow, didn't you? Being anything other than that?
Yes, I'd definitely say during pregnancy, I think it's just a non-negotiable to have a pregnancy pillow. The one I use and that I do think is the best on the market is the BB Hug Me pillow.
I hear that a lot. Yeah, people really
huge sausage. It's just like a huge sausage beanbag, basically. So you can even change how kind of soft or hard it is, because you can kind of move these little bit. Should have bought it from the bedroom to show you. So I really swear by that one. And I mean, I'm only 5'1", so it's not very difficult for something to be long enough to sort of support my ankles as well. But I think generally if you sleep on your side, you tend to sleep sort of in that kind of fetal position. So even if you're tall, it will fit between your sort of your knees.
Yeah.
And you kind of hug it, which also then helps so that you don't collapse on your shoulders, if that makes sense. Because I've noticed if I'm not sleeping in the best position or I haven't been hugging the pillow, I'm waking up with shoulder pain because I'm not used to sort of all my weight going through my shoulder. And then I also really recommend, and in clinic I lend out to patients the BB Hug Me feeding pillow as well for postnatal. Right. I just think it's not, you might be out in a cafe and well, actually the good thing about the BB Hug Me pillow, the feeding pillow, is it's got a carry case. It's really handy to take out and about, just whack it in the pushchair. But yeah, it just really, really helps to just look after yourself, and sort of it helps to bring baby up to you for feeding.
Rather than bending down towards the baby, or kind of
exactly, especially with the newborn. When they're tiny, you've really got to go down to them, sort of thing. But the BB Hug Me pillow, you can kind of tie around yourself, so it can hold the baby basically.
Yeah.
But pregnancy-wise, other self-help stuff, I just talk about ensuring you're not doing things in a one-sided way, so not crossing your legs. If you've got other children, not always holding them on one side, so trying to alternate what side to hold them on, get a bit creative, give them a piggyback instead, get them to walk a bit more, just being mindful of not doing too much in a one-sided way. Again, handbags, change to a rucksack. If you must use a handbag, 5 minutes on that shoulder, 5 minutes on that shoulder, just alternating things. Carrying shopping bags, I went down to the supermarket the other day and I didn't buy loads, but I made sure I had 2 carrier bags so that I could just spread the load and hold one in each hand and not just be, leaning off to one side. So it's quite basic stuff really, but it's stuff that you don't necessarily think about until I interview.
Yeah, perfect. Thank you. Anything else you want to add? Or
really interesting. I could talk for the next 3 hours, but I won't bore your viewers.
No, anything.
I think we've touched on sort of most things really. Yeah.
Perhaps we could have another.
Pardon.
We could have another session, maybe looking at babies. That might be interesting, mightn't it?
Yeah, I'd love to. Yeah. So we see lots of newborn babies and older children. But I'd say in our clinic, I tend to see mainly newborns. That's just what tends to come to me, basically. Yeah. Whereas one of my associates maybe sees sort of toddlers and older babies. That seems to be what she's sort of a bit more, if that makes sense. But I'd love to talk about that. It would also be good if anyone is looking for a chiropractor or a massage therapist, for example, during pregnancy. It'd be worth asking that they have a special pregnancy pillow in clinic. So we've got a pillow that we use that allows our patients to lie on their front. That's a game changer, just for their comfort, and it means that we can carry out all the work effectively, because obviously we have to do a lot on the back, and it's just got a big round hole for the tummy, space for the breasts as well, and it's lovely. And actually I had my first pregnancy massage yesterday, and was able to lie on.
Wow.
And it was just
Lying in the tummy is just, yeah, I know,
yeah,
it's isn't it? In fact, I know some women say they use that BB Hug Me to lay on their front.
Yeah,
would that be okay? They'd have to hang over, wouldn't they? Wouldn't have place for their breasts in, would they?
No.
But could that be safe for them to sleep with that on their, if they made a circle with it?
I don't think I don't think you can. It's not. It's against guidelines to sleep on your tummy, even if there's space.
So it'd just be for resting, for
resting. Yeah. I keep meaning to do it. I haven't, because I get to do it because I get treatment every week because I'm lucky and I've got associates that treat me every week, and then I've had my massage. So I'm getting to lie on my tummy for that my treatment every week. I keep meaning to do it with my BB Hug Me pillow, and my bump's not huge at the moment, so it's not. I imagine at kind of 30-something weeks, it must feel so nice to just take that weight off. But no, the cushion we use in clinic is by a company called Boost. So interestingly, actually, the BB Hug Me and Boost are both companies both products were designed by chiropractors, pregnancy chiropractors. So ergonomics have all been thought about. And the Boost one, actually, I just remember they now have. So they have the therapist's cushion that we use, which is made of a white, clean material, and because obviously we have to consider hygiene because we need to use it for multiple patients. But they've now developed one for home use.
Right.
So they've now got one. So if you've got the space in your house to have your pregnancy sideline pillow and the Boost, then you're just laughing. But again, the Boost, they don't encourage people to sleep on it. But maybe a 20-minute nap. You could do on the Boost, but it's just not, the evidence isn't there for actually lying on it for
a long period. And the same with the BB Hug Me, maybe maximum half an hour and then get off of it and don't get off your tummy, basically. Set the alarm so you don't go over longer.
But that that lying on your tummy position allow it, or just even being on all fours, for example, allowing the tummy to hang is really good for helping baby get into the right position, because that just gravity helps stretch the round ligaments at the front there, which really helps to stretch everything out and balance.
It helps with back pain, helps the baby drop away from the mum's spine, doesn't it? That's really good, like hugging a birth ball and kind of rocking back and forth. And
I've found every night I'm doing my cat-cow, which we've actually just posted on our Instagram today. So if anyone wants to have a look at our Instagram, we've got some stretches and exercises on there. And I'm just really enjoying that kind of cat-cow and that pelvic tilt type movement, because I'm, especially in my job, I actually do the opposite. I'm on my feet all day. So I'm starting to really get discomfort, come the end of the shift, because my pelvis has started to tilt forward now because of my bump. So I really want to get into that kind of that cat stretch position to just stretch everything out and just let everything hang a bit, And then the cow stretch is really nice because I'm finding I feel so just tight, your whole abdomen just feels tight. And the cow stretch is really nice for just stretching skin or the fascia, everything, and just
everything.
Feels nice.
Just one last thing, you briefly mentioned round ligament pain, which I hear quite a bit coming up, in antenatal course. And do you want to talk about that just briefly, just to finish off?
So the round ligaments, actually, let me just share my screen and show you a picture. There we go. So the round ligaments sit at the front of the womb and attach the womb. Basically, it's like the anchor onto the pelvis. And so if the pelvis is twisted, dysfunctional, sort of not sitting in its best sort of functional position, there will be torsion in the round ligament. Well, there will always be a bit of torsion in the round ligaments because they're suddenly stretching in a way they've never stretched before. So every pregnant woman, even if she's beautifully aligned and having care, there will always be a bit of discomfort at some point because your body's just stretching in a way that, particularly in first pregnancy, those round ligaments have never stretched to that extent before. but what we find is often people will talk about round ligament pain just on one side, and that's more indicative of there being an imbalance in the pelvis, and that round ligament is being sort of torsioned more. And then it's things like that can lead the baby to not be in the optimal fetal position.
Right. Is it more like a pulling feeling, Shu? How do you feel that round ligament?
Yeah, it can be pulling. It can be a dull ache. It can be sharp.
Sharp, yeah.
You know, pain. That's a whole other discussion. You know, how people describe pain, but yeah, it depends really what pressure on it is. But the round ligaments are magic. When we create when we help to release the round ligaments and create balance in the round ligaments, I mean, often I'll feel the baby moving straight away, sort of readjusting itself. Because often, you know, baby actually will be, you know, they'll have been told by midwife or a scan, yeah, baby's head down, it's all good. But in my opinion, head down isn't good enough. There's head down, and then there's the optimal fetal position. So sometimes baby might be head down, but I can feel that their head's sort of off center, and that's often because actually the round ligament on the other side is just a bit tight and not allowing them to get really kind of central and ready to get into that birth canal.
And of course the benefits of everything straightforward is that the labour is going to be more straightforward, even maybe less time, I guess, if everything's aligned, right?
Yeah, there is. I know there is a paper somewhere that basically says that chiropractic through pregnancy leads to better labour. I try not to say that to patients because there's so many factors involved in labour, and I'm saying, come and see me and have a nice short labour. But some patients do come in postnatally and say, I've got a patient that I treated through all 3 of her pregnancies. I think the first one she sort of stopped about halfway through, or would come a bit sporadically. And she ended up with a bit of a traumatic, sort of drawn out birth. Second baby, obviously often second babies are a quicker labour anyway, but was just lovely, textbook labour, textbook birth, just everything she'd wanted. I think it was a home birth. And she did attribute it, her words were, I believe that all went as well as it did because of the work we did. Working on my pelvis and my hips and stuff, but we have no evidence for that.
I don't know, but it makes sense, doesn't it? It makes logical, isn't it?
Because she had that comparison, and she was a lot more. She just, came a lot more regularly in the second pregnancy and kept on top of it, and she, as a result, she didn't really have pain in pregnancy. The pregnancy was smoother. So she saw that difference between kind of having a couple of sessions in the first pregnancy versus being more regular. Yeah.
Brilliant. That's fantastic. So I'll put it in the comments. I'll put your website and I'll put your Instagram and.
Brilliant. Thank you. Yeah. We just started a new Instagram. So there's not a great deal of content on there at the moment, but there will be, and it's all going to be a lot better than the content we had on our old Instagram, actually. So
fantastic.
Yeah.
Well, thank you so much for your time and expertise.
Oh, you're welcome.
And we'll meet again, and maybe to newborns.
Yeah, I'd love to. Yeah, definitely. Brilliant. Yeah, great.
Brilliant. I shall stop recording.
Okie dokie. Thanks a lot.